A warm good evening to everyone and welcome to yet another episode of Wednesday Wellness, clinic from Rosewalk Healthcare Hospital. I'm Dr. Veena Ganjumalla, a senior gynecologist and obstetrician from Rosewalk Healthcare with keen interest in high-risk pregnancy, infertility problems, and menopausal medicine. Now, friends, pregnancy loss can be very devastating for any woman. And today I'm going to share some information about a condition called ectopic pregnancy, which can result not only in pregnancy loss in early weeks of pregnancy, but also it can have a life-threatening complication for the mother as well. So it's very important to know about this condition and also come and can have early diagnosis and timely treatment because 1 to 2% of pregnancies can result in ectopic pregnancy. Now I have received a lot of queries about this condition and I'm going to answer them during my talk. One of the first question is, what is ectopic pregnancy? So to share that with you, it is any pregnancy which is located outside the uterus because the normal location of pregnancy is uterine cavity. So when it is located in one of the fallopian tube, which happens in majority of cases, in about 95% cases, it is called tubal ectopic pregnancy. And in rest of 2 to 3% or 5% cases, it can be either cervical pregnancy, or it can be a previous cesarean scar pregnancy or ovarian pregnancy, and it can also happen in the abdominal cavity. Now, the second question which I have, often been asked is that how does this ectopic gestation results? Now, before that, I will share how a normal pregnancy occurs. Now, normal pregnancy occurs by the fertilization of egg, which is released from one of the ovaries. We have two ovaries and which are alternative releasing egg every month from the ovary. Now, fertilization of egg and the sperm which traverses from the vagina through the uterine cavity into the fallopian tube, and the fertilization occurs in the fallopian tube, one of the fallopian tubes. Now, this fertilized egg, after a few days, traverses to the uterine cavity, gets implanted there, grows there, and a normal pregnancy occurs. If somehow this fertilized egg does not traverse into the uterine cavity and gets implanted and goes into the fallopian tube, which is a very tiny, the lumen of the fallopian tube is very tiny. So after about 6 to 8 weeks, depending on patient to patient, the tube can stretch and cause torrential hemorrhage, and patient can come in a very critical medical condition to us. It's important to know about this condition and have early diagnosis and timely treatment. Now, third question which has been asked to me is, do I stand at a risk of developing ectopic pregnancy? So my answer is that yes, anyone, as I shared with you, 1 to 2% of the patients can have ectopic pregnancy. So any sexually active a lady who is planning pregnancy can develop ectopic pregnancy, but yes, certainly there are few conditions which predisposes a woman to ectopic pregnancy, and these are any lady who has had a ectopic gestation or a pregnancy in the past, she stands at a high risk. Any infection of the tube, generally tuberculosis, which is very common in our country, that also predisposes to the ectopic pregnancy because it damages the tube, and then that function of the tube of traversing the fertilized egg into the uterine cavity does not happen, and it gets located there only. Then any surgery in the past on the tube or any abdominal surgery also causes some adhesions to the tube, and then the normal function of the tube does not happen. Then any patient who is either infertile for a long time or has history of having taken some infertility treatment, she also stands at a high risk. Now, often it has been asked, then how do we know that yes, we are having a normal pregnancy or an ectopic pregnancy? The simple answer to that is time and again we stress on this, that as soon as patient comes to know that she is pregnant, it is important that she consults a gynecologist. And how does she knows that? She misses the period. She, it's very common for a lady nowadays to have a urine pregnancy test. She sees those two lines on the urine pregnancy kit, and she should immediately come to us for checkup, so that we can guide her according to proper protocols, how to go about the next investigations or next course of action. But there are some very early non-specific signs also about this condition, because they are even common for a normal pregnancy also. And these are, as I already said, she misses the period, her pregnancy test is positive, but then she also has this lower belly pain, abdominal pain or lower belly pain, which is crampy in nature, and sometimes the pain is intermittent, and it also occurs when she passes, stools. So all this should, at least tell her or point to it that all is not well, and she should consult a doctor. Now, when she visits a gynecologist and she comes to us, what do we do? How do we diagnose in such an early pregnancy? Maybe she's just 5 weeks and she's having pain and she's having vaginal bleeding, which can be just spotting. So it could be even, some of the other condition like a normal pregnancy, which is getting miscarriage. But it is important that she comes to us and we, examine her. Now, in our examination, sometimes we do come across, some finding which point to the, that she is having this tubal pregnancy, and this is that we might find some, tender mass in one of the, sites which are where the fallopian tube is located, and then we can kind of, accordingly go for tests. And these different tests are one of the important tests in ectopic pregnancy or any normal pregnancy to check that all is well is a hormone tested called beta HCG. Now, this beta HCG, normal cases, it doubles in 48 hours, and we, feel that all is well for the patient, that your pregnancy is as it should be. And this happens only up to the 6 weeks, that it goes on doubling in 48 hours. Now, in ectopic pregnancy, what happens? The rise is either not there in when you repeat the test after 48 hours, or it is not doubling. So that is one indication that all is not well, and it could be one of either a failing pregnancy or a ectopic pregnancy. Now the next investigation is doing an ultrasound. The ultrasound also comes very handy in patients of ectopic pregnancy for the diagnosis, and especially I would say that ultrasound done by vaginal route, which is called a transvaginal ultrasound. Now this is very important for this investigation for this abnormal located pregnancy, because it tells us that in a patient who has missed her period, her pregnancy test is positive, and we are not able to find a normally located pregnancy in the uterine cavity. That means the uterine cavity is empty. And we can also sometimes see a pregnancy which is located in one of the tubes. So that clinches the diagnosis, and we can do a timely treatment in these cases. And that is very, very important, because if these steps are ignored, and the pregnancy goes on without knowing that she's having or harboring a ectopic pregnancy, then after a while, say about 6 weeks, depending on the patient, the tube can stretch and undergo a rupture, and then it's very difficult to handle the situation. Patient may not be near a medical facility and may not reach the hospital in time. So it is very important, I will stress again, to have a early diagnosis, and the fatal condition can be prevented if we stress on the early diagnosis. Then next is that what do we do after we see the this tubal pregnancy, because sometimes things are not very straightforward and we see the mass, but in some cases we do see a mass. Now in patients where it is a suspected pregnancy, we follow the patients with the beta HCG test, and we keep the patient under our supervision, and she is called for a repeated follow-up also. And beta HCG tells us whether she is going to be, how she is going to be treatment. Now, treatment modalities in these ectopic pregnancies can be in three types. It can be either an expectant treatment, which is sometimes very rarely done, or it can be a medical management or a surgical treatment. Expecting treatment is only reserved for ladies who have very low beta hCG, say less than 1500 or maybe 1000. And when we are doing a serial beta hCG, they keep on falling, and we can keep them under observation and leave them for any definitive treatment and observe them. Second is the medical treatment. Again, there are certain prerequisites where we are doing this medical treatment, which is done by a single injection of a drug called methotrexate, which is a very timely, time-tested medication for this condition. And but it is reserved for cases which are again having low beta hCGs to the tune of about 1500 and certainly less than 1500, a very small mass in the tube, which is about 3 to 5 millimeters. And then also, there should be patient should be willing to come for the follow up, because then there is a protocol after giving the injection of testing the beta hCG again on day 4 and 7 to see yes, your treatment is effective. Because if in a repeat beta hCG the levels do not fall, then you may have to do some definitive treatment in the form of surgery. So these are, and then also the patient should not have any contraindication to the drug. That is foremost. And third type of treatment, which I said, was surgical treatment. Now, surgical treatment is the mainstay of ectopic pregnancy, and again, it is depending on the what surgery we are going to do is depending on the what condition we receive the patient. If it's the diagnosis of ectopic pregnancy, it's an unruptured ectopic pregnancy, then we do a laparoscopy, which is a keyhole surgery, which is a very good gold standard for this ectopic pregnancy. We look at the tube, we look at the other side of the tube. The bilateral tube should be normal, and we also see how many children the lady has. Maybe she has completed her family. Then we do a removal of the tube along with the this ectopic pregnancy which is there on the tube. And then we also can, if the patient is willing, so that she is not, as I said, there is a risk of recurrence of this condition, we can also take consent for doing a ligation on the other side of the fallopian tube, and the treatment will be complete. But if the patient has come in a very critical condition or a very unstable hemodynamically, she is not stable, and we have received her in that critical condition, then sometimes we may have to do a open surgery as well, and we kind of see the amount of blood lost in the blood leak in the peritoneal cavity, and again the treatment still remains the removal of the tube along with the abdominal lavage and removal of that topic pregnancy parts, so that they don't get kind of located elsewhere. So that is, in nutshell, the treatment of this thing, and then the follow-up of the condition, both medical and surgical treatment remains with beta hCG till it gets negative, and then patient, depending on the condition of the patient can be discharged. If it's an unruptured tube, she has come well in time to us, she can be discharged with a follow-up of doing a repeat beta hCG within 2-3 days, and with hematinics and with kind of other supportive treatment. Now, one of the other questions which I've still just now got is that what are the chances if the patient, maybe the first pregnancy it was, and unfortunately it has resulted in ectopic, what are my chances of getting though I said there are chances of getting a repeat ectopic pregnancy, but patient can, in about 60% cases with one tube which is healthy, can get a normal intrauterine pregnancy. So there is nothing to be sad about it. She can be, but she has to be next pregnancy on a lookout that she may not develop this, ectopic pregnancy again. That's the only thing. but she can have a normal intrauterine pregnancy also. So that was all, friends, about ectopic pregnancy. I'm sure some of the things which I said would strike a chord with you, and you'll come whenever next you are see that pregnancy test positive. Come to us at Rosebud, and we are there to help you anytime. For any queries, I am available at my email, veenaganju@yahoo.com, and I'll be only too willing to answer any queries which you have. Thank you so much for your patience. Are there any questions, Maima? Maima, कोई questions to me? I can answer them if you have.
How soon can we get to know that we have an ectopic pregnancy?
See, it is, as I said earlier also, you should, immediately come for testing. It could be a normal pregnancy for all you know. But if you come as soon as you miss a period, say about 5 weeks or 6 weeks before that, and that bloaty feeling, and having that belly pain, as I said, or maybe urine passing and pain, it causes pain, then certainly you should come, so that we can help you and guide you. Maybe, I mean, immediately we may not be knowing, because it can be even a failing pregnancy. As I said, if the beta HCG is very low, sometimes it can be a failing pregnancy also. So that is, I think, answers your question. Anything else? So I think I'll take your leave for today, and see you soon in one of the other episodes of Wednesday Wellness with some other interesting topic. Please take care and be in touch. Thank you so much. We have some few questions more. Okay, I can answer them. Huh? That?
What question I had?
I can answer.
Do the shoulders also hurt during it?
Yeah. So, there can be a pain in the shoulder tip also sometimes, and that happens when there is a, I didn't touch that, that can be a condition called ectopic pregnancy, which has become chronic now, which can even present, within 3 to 4 months after missing the period, and patient can have small amounts of bleeding and all. So, any small amount of bleeding in the peritoneal cavity sometimes can give rise to, especially right shoulder pain. Certainly, yes. One of the symptoms can be that also, but generally it occurs when there is a bleeding, or, the ectopic pregnancy sometimes, tries to get aborted and, causes bleeding into the peritoneal cavity, which may not be very alarming. So that case, a patient can have a shoulder pain, and that too in the right side of the shoulder. Any other?
Can bad sperm cause ectopic pregnancy?
The poor quality sperm, it has been, some researches are going on. Sometimes they can, some DNA alterations can lead to, that is the current research going on, can lead to, ectopic pregnancy. Yes, yes, I would say yes. But we cannot, there are no current kind of proven recommendation on that. Yes, it can cause. but it has been in some studies proven that it can cause. Anything else? Can we call it a day then? Okay. You can always write to us at Rosewalk, and we'll be only too happy to answer any of the queries on any other subject also to you.